Hey guys, it's Steven at CORE Therapy and Pilates. Today I want to go over a topic about in-network, or what I call contracted or insurance contracted facilities versus non-contracted facilities or out-of-network, which is what we are here at CORE. I saw a video just the other day from a friend of mine down the street who's a physical therapist, Jared, who got me involved in the cash-based world, and this was a great post that he put out, and I think it's fantastic for all potential physical therapy clients to hear this. So what happens is we're at a point now where deductibles are higher than ever, copays and co-insurances are higher than ever, and January, just a few days away, we're going to see those deductibles turn over. So people who are in network and have a high deductible, let's say $2,000, $3,000, $4,000, $5,000, which is very common today, they'll have to pay out of pocket to see a physical therapist in network or out of network until that deductible is met. So the question becomes, what's the difference in network quality of care? Well, when you come to a place like CORE to see me or my physical therapist, Allison, it's one-on-one care with the physical therapist for the whole time. We don't use aides or assistants. It's very focused on the patient and client. It's not what the insurance dictates and thinks we should be doing. When you go to an insurance-based clinic, it's really based on what your insurance says and demands and dictates. So it's a very different thing. But what I wanted to present today are a couple questions that you should ask if you're a potential physical therapy client trying to determine the cost and what's the better value for going to an in-network place or an out-of-network place. So I'm going to read off a couple questions that I want you to ask your insurance providers. 1, until I meet my deductible, what can I expect to pay for each session of physical therapy at an in-network PT clinic? They may only give you percentages like 80 or 90%, but the typical fee that the private practices will be charging will be $250 and above. And if you're going to a hospital facility, it will be charging $500 or above. The next question, what can I expect in reimbursement or application to deductible if I get physical therapy at an out-of-network provider and send in self-claims? So just so you know, if you do get in touch with an insurance company, they will try to persuade you to go in network and not out of network. That's just how it is. It keeps their contracts and whatnot, keeps them in a little more control. I'll just leave it that way. Now, what are the questions that I would want you to ask the in-network facilities? So you've called me, we've gone over what we can do. What do you call, when you call the in-network facilities, what do you ask them? First one, on average, how many patients per hour do your providers treat? Many times the physical therapist there is seeing 2, 3, 4, 5 patients an hour, sometimes more. Are only physical therapists providing the care, or do you use assistants, aides, or techs? How much one-on-one time will I get with the physical therapist in each session? On average, how many times per week do patients come in for treatment? And with knowing this information and then coming in to see me for my free discovery session, we can really look at what's going on and what's the best solution for you so that you can make a better decision about your health and moving forward with all the information and knowledge. So this is just something to chew on as we move into the new year. I think a lot of people think because I don't take insurance that it's going to be a lot more expensive than going to the place that does take insurance. But I typically see people once a week and get them better very quickly versus going to an insurance-based facility and going in 2 or 3 times a week and doing the homework that you can do at home, that I teach you to do at home, instead of having some aide that makes $10 an hour watching you do it. So a little difference in the quality of care, a little difference in the speed of getting people in, and all those things. So that's it for today. I just wanted to go over this the in-network and out-of-network. I think a lot of people get caught up in that and don't truly understand the deductible scenario, the co-insurances, the copays. So I hope this helps. If you have any questions, just leave them in the comments below.